Mr. Speaker, maybe I can speak in a language the Leader of the Opposition will understand. They're going to cut the dental. They're going to axe the pharmacare, they're going to break the health system, and they're going to destroy childcare. The difference between those slogans and the nonsense he throws around, the vacuous garbage that's best left for Nabisco, not for the House of Commons, is that's the stuff he's actually going to do. And at some point, he's going to have to look in the eyes of seniors and tell them what he's going to do to dental care. He's going to have to look in the eyes of diabetes patients and say what he's going to do with their diabetes medication. At some time, the vitriol done and the truth comes.
Colleagues, we're skating pretty close to the line. I'd recommend for members to ensure that they don't do that.
Mr. Speaker, I understand that when that member thinks of the prospect of a carbon tax election, he comes unglued and becomes very rattled and loses control of himself, waving his hands around because he's desperate to quadruple the carbon tax to 61 cents a litre. He's desperate to push a government takeover that will shut down people's private drug plans and ban them from having access to their medical plans. Common sense Conservatives will axe the tax, build the homes, fix the budget, stop the crime, and protect your drug plan. How about that?
The Honourable Minister of Health.
Mr. Speaker, this is the guy who said dental care doesn't exist. This is the guy that said providers won't sign up. Well, I got news for you. 750,000 people across this country got care. I also got news for you, Mr. Speaker, and that is more than 80% of providers has signed up. We're getting it done. So he can fearmonger, he can scare people, but we're going to get it done on pharma as well. We're going to make sure that diabetes patients get their medication. We're going to make sure that women get their contraceptive, because that's what freedom looks like. A woman who has choice over her own body.
I'd like to remind all ministers, all members, that answers should be directed, questions should be asked and answers should be directed through the chair. And I'm going to again ask members to make sure we don't skate too close to the line. The Honourable Leader of the Opposition.
What his plan does is quadruple the carbon tax to 61 cents a litre and imposes a single payer that bans women from using their existing private plans to get contraceptives or any other form of medication. That's what a single payer means. And that is not what freedom looks like, Mr. Speaker. What he actually wants to do is quadruple the carbon tax, which will grind our economy to a halt. It will be a nuclear winter for our economy. Why don't we allow Canadians to vote in a carbon tax election to decide if they're ready to axe the tax, build the homes, fix the budget, and stop the crime?
The Liberals are too weak to stand up to Doug Ford, so some patients are leaving surgeries with thousands of dollars of bills. The Liberals are too weak to stand up to Daniel Smith, and so people in our province are forced to pay to see a doctor. See, that's what Conservatives do. They cut and gut healthcare so their big business buddies can use that to rip off Canadians even more. Why is the Liberal government letting Conservatives privatize our healthcare system?
The Honourable Minister of Health.
Well, Mr. Speaker, if you're going to be talking about being too weak, 2 days after the NDP leader got a letter from the leader of the Conservative opposition saying to back out of standing up for pharmacare and standing up for improvements in the healthcare system, he ran away. And if he ran away from that, how is he going to stand up for Canadians, is what I would ask, Mr. Speaker. And I would say that we had a chance. We were working well together. We got things done on dental. 750,000 people, over 80% of providers. We were working well together on pharmacare. If he has ideas, he knows we were all ears. But he's all about politics, Mr. Speaker. He's all about trying to divide rather than working together.
colleagues,